Hello, my name is Andrew Dawson, and today I'm going to be talking about psychological treatment. I will also specifically be focusing on a type of treatment called cognitive behavioral therapy, also known as CBT for short. Here's my overview of psychological treatment. What is psychological treatment? Psychological treatment is when a trained professional helps someone develop new ways of thinking or behaving that is better for them. Therapy is not just like talking to a friend. It is planned and guided by psychological theories, and it is carried out by a trained professional that will actually help you. There are two main types of psychological treatment. There's talk therapy and there's biomedical treatment. Psychologists mainly focus on talk therapy, but psychiatrists are also able to prescribe their patients medication to help them. Why do people seek treatment? People seek psychological treatment for many different things. Sometimes it's voluntary. People want more from their life, or they want to work through long-term issues. Or maybe they just got out of a relationship and they need to talk to somebody. Other times, it's not voluntary. If your spouse forces you to go, sometimes the courts will force you to go. And if you're a child, your parents can also force you to go to therapy. There's a difference between genders that go to therapy. More women go to therapy than men because society historically has told men that they need to be a man about it and figure it out themselves. Luckily, this is changing and more men are starting to go to therapy. What is psychotherapy? Psychotherapy is talking. It is a conversation between the client and the therapist. The conversation is structured, normally led by the therapist asking questions. The idea of the conversation is for both the client and the therapist to get ideas of the client's thoughts, emotions, and behaviors. Psychotherapy will help them cope with difficult situations. It will also help them change unhealthy thought patterns. People also will use psychotherapy to deal with stress, trauma, grief, anxiety, or depression. Another important part of psychotherapy is the therapeutic relationship. This is the relationship between the therapist and the client. This relationship is very important. Therapy works because the therapist and the client both understand the goals. In an ideal world, the therapist and the client agree on the goals and work together as a team. This can be challenging if the client is forced to go to therapy, but it is a lot easier if the client is willing to go to therapy, and typically they will have a better relationship. To get all the information from part 1, I used the online Pearson textbook. For the second part of the presentation, I chose Cognitive Behavioral Therapy, or CBT. For this part of the presentation, I used our textbook, and I also used websites from the Mayo Clinic and the American Psychological Association. I also found a good article on the history of CBT and how Dr. Aaron T. Beck founded it. CBT is a type of talk therapy. It helps people change unhealthy thoughts or behaviors. CBT is used for a lot of different things. It helps people deal with stress and anxiety. It's also used for PTSD and eating disorders. People also use it for substance abuse. Like I said before, CBT was founded by Dr. Aaron T. Beck. It was founded in the 1960s. Before Dr. Beck founded CBT, therapy focused on your actions and what happened outside of your body. But now therapy focuses more on your mind and what happens inside of your mind. Dr. Beck said it's not the situation itself that's the problem, but it's how we interpret the situation that makes it a problem. He called these interpretations automatic thoughts. By helping clients change and identify their distorted automatic thoughts, he found that his clients could handle outside situations and thoughts better. As Dr. Beck continued his research, he found CBT worked well with a lot of different issues, like depression, substance abuse, anxiety, and even relationship problems. CBT is effective across all age groups, from elementary school students to nursing home patients. It is used all over the place. It is used in schools, nursing homes, hospitals. In 1977, CBT was found more effective than some medications. This really helped spark CBT to get a good reputation. Dr. Beck is considered the founder of CBT, but other people have helped CBT's success, like his daughter, Dr. Judith Beck. and one of his students, Dr. David M. Clark, have contributed a lot to CBT's success. Sometimes CBT cannot be effective. Most of the time, CBT is very effective, but in certain cases, it is not right for everyone. CBT is not a good fit for people with severe mental disabilities, active psychosis, or people with suicidal thoughts that they plan on acting right away. CBT also doesn't work as well if the client is not motivated and willing to talk with the therapist. So for an example, if a court forces somebody to go to a therapist, CBT will not be as effective as somebody that is willing to go. Psychological treatment helps people build healthier ways to think and behave. Psychotherapy is the process of working through thoughts and emotions with a trained therapist, and the relationship between the two is key. Cognitive behavioral therapy was founded by Dr. T. Beck. It focuses on changing unhealthy thoughts and emotions. It is one of the most widely used forms of therapy. My sources for this presentation were from the Mayo Clinic, the article by Beck and Fleming in 2021, and our online textbook. I know we are supposed to reference specific DSM criteria, but there is not any DSM criteria for CBT. Instead, what I found was that CBT works for a lot of different conditions, and therapists use the DSM to diagnose different conditions that can be treated with CBT. Thank you for watching. I enjoyed learning about CBT, and I enjoyed taking this psychology class.